gonna sit there.
You are, Lynn.
Okay. I like it. This has to do with injections.
She's Anna.
Closer.
She's wonderful.
She comes on Saturdays and Sundays with
And
her
she,
family.
and
to
she
be with
comes
us and help us.
yesterday too.
Yesterday was a special request, but she doesn't sing.
Oh,
But she does special requests for nurses. We need somebody. Well, that's the common problem we have with people holding coffee enemas. Is everybody here that should be here?
Andrea just had to get a jacket. She was a little chilly. She'll be here in a second.
So I don't blame people when they do the first coffee enemas, they have trouble. And if I tell a doctor to do a coffee and they say, what for? I'm not even constipated. It's hard to explain the theory. And then to understand, because then they want proof. My dad says, can you prove to me blah, blah, blah? My dad's a thoracic surgeon. And I've explained to him, but he's always like hearing with half of his head.
Right.
Yeah, sure. Yeah. Who's ever proven that that thing travels all the way and eliminates? Well, if you do a coffee enema, I guess you could understand the feeling. As a doctor, when you do the coffee enema, you start feeling these changes. And then you have this discharge of bile that comes out of this. Where is that coming from? I usually get that when I have some chili peppers on very greasy food. But then they realize, well, coffee enema, coffee going through. They start maybe connecting or connecting the dots, but they don't want to do it because they never talked about that in medicine. In school of medicine, they never talk about a coffee enema. They talk about enemas to relief. If somebody's bloated. Or they treat just to clean before a surgery, a colon surgery, or they give other things to clean the digestive tract. But I guess it would be far-fetched that somebody out of the blues accidentally found out what a coffee enema does. But most discoveries in this world are accidental. Most we're not because we're the greatest genius, the greatest minds in the world. We're not so smart. If we're so smart, probably wouldn't be the situation anyway, right? Global warming, niños, and cancer, and left and right, and younger people getting sick. This should not be happening. So that's a little step back when we thought we would accomplish all these great things. Now we're still got a long way to go. I would say the biggest disease in the world is society, the cancer of society, that people or families are disconnected, or not enough love to go around, not enough hope or humanity or understanding or family values. Well, just human values. I mean, it's in family because of that's a 2-hour session, but just human values, I guess, are getting lost in the shuffle. A lot of people who come here, when they come here, they are super dupers. They do lots of things. They're like bunnies. They're left and right, north and south, east and west, and they're going each way. Sometimes get lost. They don't even know where they're going. But they think they're going, but they're going fast. They say, hey, you gotta slow down. Especially when you don't know where you're going. There's so many places. You can look at a lot of maps and directions on life to where I should go. Should I do this? Should I do that? Should I change religion? Should I change countries? Should I change friends? Should I change my mom? No, I can change my mom. I love my mom. So we got to adapt to the world and to life. Life is not the way we want it. I would love to work in Hawaii by the ocean and with some white shorts and my surfboard in the back of my office. But sometimes we don't get what we want in life, and we have to do the best with it. There's a lot of people in this world that really have it difficult, and they have no house, no money, no electricity. Like the story in the newsletter, like Lupita. That's a good story. Humans usually, against all odds, find a way to survive. And nowadays, we're more proactive. If the doctor says, well, you got 6 months to live, or you got 12 months to live, or there's nothing I can do for you, I'll send you to a hospice. Humans will now take that with their hands folded. They will look for something. Now humans look for something. They won't believe that this whole beautiful physiological biochemistry body will shut down because of disease, and humans cannot find a way to treat the disease. It's impossible for a human brain to comprehend how we cannot find a problem or the cause or the inner underlying problem. There's always, all diseases have a road, like a murder case. There's always a track that they leave of fingerprints or bad things you did in life, a road to brought you to this situation or to this time.